Hello and welcome back to our channel. I'm Dr. Madhvi Vash from Bharat Homeopathy. Today I'm going to discuss an important topic that affects millions of people worldwide, liver cirrhosis. Yes, in today's video I will explain to you what liver cirrhosis is, its symptoms, causes and holistic homeopathy treatment. I will give you scientific details based on research and my own clinical practice. So stay tuned and don't miss a single minute of this video. Let's begin the video with what liver cirrhosis is. See, the liver is one of the most vital organs in our body. It is often perceived as a second brain because it regulates vital functions in our body. Your liver helps detoxify your blood, produces bile for digestion, and plays an important role in regulating cholesterol and blood sugar. And one advantage that comes with your liver is, what if it gets damaged? It tries to repair itself. I mean, in short, if I say the liver can regenerate itself. But how does liver damage happen? Liver damage occurs when the liver is repeatedly exposed to toxins from excessive alcohol intake or infections, etc. Over time, your liver tries to repair itself, and this repair process can lead to formation of scar tissues. This scar formation is called liver cirrhosis. As cirrhosis progresses, more scars build up on your liver, and this disrupts the normal liver function. This condition persists. It can eventually lead to liver failure. Well, liver cirrhosis is a chronic liver disease. It takes time to develop, and even during its primary stage, you will not observe major symptoms and sometimes it may go unnoticed. Alright, I have explained to you what exactly cirrhosis is. Now let's discuss the stages of how it develops and what happens to your liver at every stage. See, liver cirrhosis has two stages. The first is compensated liver cirrhosis and the second is decompensated liver cirrhosis. Let's first discuss what compensated cirrhosis is. In compensated liver cirrhosis, your liver is still able to function properly. You will not notice any symptoms during this stage. Even people who are in this stage may have a median survival time of more than 12 years. Now let's talk about the second stage, which is decompensated cirrhosis. In this stage, your liver stops functioning properly and further liver complications can develop such as jaundice, ascites, a condition when fluid buildups in the abdomen, hepatic encephalopathy, when toxins start building up in brain causing tiredness and confusion, etc. Well, people with decompensated cirrhosis have a median survival of 2 years. This stage is liver failure and a patient requires immediate medical intervention to avoid any fatality. Alright, ignoring your liver problem is not an ideal pursuit of living a healthy life. You may be surprised to know that liver disease is the 11th leading cause of death worldwide. If I tell you the global data of people with chronic liver disease is 1.5 billion, which is a huge number. Only 4.5 million adults in the US, or you may say 1.8% of population have chronic liver disease. I know this number is no less than a nightmare for you, but don't worry. Liver disease can be reversed if proper and timely treatment is taken. Now let's discuss the causes of liver cirrhosis. Before I begin, I want to remind you that if you have any liver problem due to the following causes, it is important to talk to your doctor or healthcare provider right away. The first and foremost cause is prolonged alcohol consumption. Excessive alcohol consumption can severely affect your liver functions, resulting in cirrhosis or liver failure. Your liver breaks down alcohol, but when too much alcohol is consumed, your liver becomes overloaded and unable to process it effectively. Subsequently, it can cause liver inflammation or scarring. Now I come to the second leading cause of liver cirrhosis, that is non-alcoholic fatty liver disease. Yes, non-alcoholic fatty liver disease has no link with consumption of alcohol. This condition occurs when fats start accumulating in your liver, making it inflamed. Non-alcoholic fatty liver is often linked to type 2 diabetes, obesity, high cholesterol, and certain metabolic syndromes. This condition can turn into liver failure if left untreated. The third cause is hepatitis B and C viral infections. These viral infections target the liver and cause inflammation if left untreated, resulting in liver cirrhosis. Well, between the two types of hepatitis, hepatitis C is more dangerous for you as it often has no symptoms until significant liver damage happens. You will be surprised to know that 1 in 4 people with hepatitis C develop cirrhosis. This is a huge number that may raise a concern. Well, the fourth is the use of certain medications and substances. Certain medicines such as OTC medicines, NSAIDs medicine, anti-malarial drugs, etc. can also cause damage to your liver function if used for longer time. Again, these medicines can interact with your liver enzymes and slow down liver functions, resulting in liver failure. Certain genetic disorders can also cause liver cirrhosis. Yes, if your parents or anyone in the family has or had any kind of metabolic disorders, then you may inherit the disease from your parents. Genetic metabolic disorders like hemochromatosis, a condition marked by excessive iron deposits in the liver, and Wilson's disease, which cause excessive copper accumulation in the liver. These inherited metabolic disorders cause metabolic imbalance in the liver, resulting in hepatic cirrhosis. Now let's talk about the sixth cause of liver cirrhosis, that is autoimmune hepatitis. Yes, immune dysfunction of your body can also result in cirrhosis. This happens when your body's immune system mistakenly attacks your liver cells, causing inflammation and long-term damage. Well, I hope you would have a better understanding of how liver cirrhosis can occur. Now, I will discuss how you can identify whether you have liver cirrhosis or not. I mean, what symptoms you can observe if you have cirrhosis. See, liver cirrhosis is usually asymptomatic during its primary stages, but when it progresses, you may experience several symptoms. Well, nonetheless, I will discuss what symptoms you can notice. You can feel extreme fatigue. Your liver is unable to regulate all the vital functions in the body, thus making you feel tired and weak. You may feel nausea and loss of appetite, as your liver is unable to produce enough liver enzyme and remove toxins from the blood. If you have cirrhosis, you may notice itching. This can occur due to the accumulation of bile salts under the skin. Swelling in legs, abdomen, and ankles can also occur if you have cirrhosis. Yes, because your liver loses the ability to regulate the body's fluid balance, this fluid can accumulate in the legs, abdomen, and ankles, causing them to swell. You know, people with cirrhosis also notice bruising and bleeding easily. Yes, bleeding is usual in cirrhosis as your liver is unable to produce enough clotting factors. Jaundice can occur if you have cirrhosis. Yellowishness of your skin and eyes if your liver is unable to process and remove bilirubin, which is produced when your liver breaks down old RBCs. If this bilirubin continues to build, it can cause yellowishness of your skin. Sometimes blood vomiting can also happen due to portal hypertension. If a person has a liver failure, toxins start accumulating in the brain, causing forgetfulness and memory loss. This is the advanced stage of liver cirrhosis and it is called hepatic encephalopathy. Alright, I have discussed what could be the possible symptoms of liver cirrhosis. Now, if you suspect that you have any symptoms, then I must advise you to consult a liver specialist without delays. Early diagnosis and treatment can guard your liver from further damage. See, liver cirrhosis can easily be managed with homeopathic medicines. I have seen many patients who were earlier taking treatments from many doctors, but when they approached me, I have done a complete analysis of their cirrhosis and offered them a customized treatment based on their constitution and symptoms. Now, after taking our medicines, they noticed an improvement in their liver condition within just a few days. We at Bharat Homeopathy have treated thousands of liver cirrhosis patients worldwide, and our liver doctors have treated those who were denied treatment because of complete liver failure. We have won the hearts of people because we believe in treating a patient as a whole, not symptomatic. Homeopathy does wonders in treating liver patients, and we have a strong record of positive patient feedback. If you want to say goodbye to your liver cirrhosis, then call us on our number and begin your treatment regime today with no side effects and big bitter pills. If you found this video helpful, don't forget to like, share and subscribe to the Bharat Homeopathy YouTube channel for more such health related videos. Stay healthy and take care of your liver. Thanks.